Hello, everybody. Welcome to the Barcoding Huddle. I'm Jody Costa, the Vice President of Marketing for Barcoding Incorporated. Barcoding is a supply chain automation and innovation company dedicated to helping organizations like yours be more efficient, accurate, and connected. And that includes healthcare, which is why we're here today. With our strategic partner, Honeywell, I cannot wait for all of our panelists to join me because we have a very special huddle today where we're going to be introducing a brand new product called the CT30. The Honeywell CT30 is making an impact, immediate impact for nurses and healthcare facilities around the globe. And we're here to talk to some of the experts. We're also going to do a deep dive into a particular workflow that Barcoding and Honeywell are very passionate about. So without further ado, let's get this party started. So can my panelists please join me on camera, and we're gonna hit the ground running. All right, I'm seeing some lovely faces joining me. Welcome, everybody.
Hello.
Hello.
Hello. Hello. Welcome to the huddle. We're so thankful for our strategic partner, Honeywell, to be sponsoring this conversation today. So thank you, Honeywell, so much. The Honeywell Safety and Productivity Solutions group provide products, software, and connected solutions that improve productivity, workplace safety, and asset performance for customers around the globe. I mean, Honeywell, you are truly a leader. So thank you so much for being here. And thank you for the CT30. I think our whole team's super excited. I know that there's lots of folks out there who can't wait to get their hands on this. So really excited to dive in. But first, I think it's important for people to understand who you are and what your backgrounds are. So quick introductions. I'm actually going to start with my own team at Barcoding first, save the best for last, save the Honeywell folks for last. So Rob, would you mind kicking us off, and then we'll go around the room?
Absolutely. Thank you, Jody. My name is Rob Kisleff, and I am the product manager for our patient's belonging tracking solution. I've just celebrated my 4-year anniversary here at Barcoding, and have been in the AIDC mobile industry for over 20 years, primarily around solution consulting, professional services, product management, and program management. I'm based out of Northern California, and very happy to be here today.
Awesome. Thank you, Rob. And we're so thankful to have you on the team. Sue, how about you give us your scoop?
Hi, good morning, everyone, or I should say good afternoon in some parts. My name is Susan Hosey. I've been with Barcoding. Actually, I'm sort of like Rob. I'm on my anniversary too. It's been 7 years.
Yeah.
And I've been in the industry for over 20 years. Started off in the AIDC. Now I'm moving to the healthcare, and I'm digging it a lot. I got to tell you, it's definitely interesting. I'm out of the Oak Brook office in Illinois. I live in Northwest Indiana, which is probably about a half an hour from Chicago. And just looking forward to this new CT30 and what else we have to offer.
Thank you. Yes, and hardcore Bears fan, might I add.
Yeah, we don't want to talk about last night.
Awesome. Well, thank you so much for being on the team, and can't wait to see all the great stuff that's ahead for you. GW.
GW Hall, hardcore Steelers fan, just right now. I've been with Honeywell for the last 5 years. I'm a senior channel business manager, so I work with the Barcoding team. I've been in the AIDC space for the last 15 years. So excited for this new product, and looking forward to showing this today of how it works in the Barcoding solution as well.
Awesome. Well, thank you. And thanks, obviously, for all you do with our partnership. And finally, our very special guest, Mark, give us some details on who you are.
Yeah, thanks, Jody. Certainly appreciate the opportunity to be here with you guys and the team today. Always great to work with such a great partner. So Mark Ancona, I am a senior account rep. You'll probably want to edit this out as I just muttered my way through that. Senior strategic account rep in healthcare for Honeywell, serving the western half of the U.S. I've got about 20 accounts for which I have direct responsibility, all in the western half of the U.S., and then tertiary responsibility for all healthcare in the geo. I have been in the AIDC AIDC space for 20 years now. Actually, just celebrated my anniversary in the industry, and been with Honeywell for 7. So, kind of grew up in doing all things AIDC, manufacturing, supply chain, retail, etc. And back when I was a partner of Honeywell's, just like you guys, I discovered this thing called healthcare back in 2008, when the economy was kind of sailing off the edge of the flat Earth, and we needed to kind of reinvent ourselves at that time as a reseller. And again, I discovered healthcare then, and we built a nice healthcare practice. And then Honeywell came around and recruited me back in 2016, and
Nice.
that's what I'm doing today.
That's awesome. Well, we really appreciate you and your expertise with the team. Obviously, we have a ton of data capture, automated data capture pros on the squad, but nice to also have someone with some longevity in the healthcare space. So first off, just Honeywell team, congratulations on the launch of the CT30. I know this is a very exciting time for everyone on your team. So congrats to you. We're excited to be part of it, of course. But Mark, I'll just get started with, you talked about your experience like getting into the healthcare space back in 2016 and starting, I'm sure you've seen a tremendous amount of change, but maybe just talk to us about a little bit, opener about Honeywell's traditional support in the healthcare industry. I mean, healthcare is such a big term, so maybe help break that down for us a little bit.
Yeah, sure, Jody. So, Honeywell is a big company, right? And, we've got plays across so many of our other SBUs as well. So, for example, we've got probably over 500,000 or 500 million actually workers that are being protected every day by Honeywell personal protective equipment. So that is around the globe, as you might well imagine. Other areas that we play in, of course, is in our fire and security and technology industries, and we've got over 500,000 sites globally that are protected there as well. And of course, what we're here to talk about today is healthcare and what Honeywell is doing in healthcare. So we've been at this for quite a long time. In fact, our Xenon scanner has been the leading scanner and has really become the industry standard in healthcare over the years since we first introduced it. We boast at least a 50% market share on Xenon scanners, and that's across all workflows within clinical and even non-clinical settings in healthcare. So that's all our other competitors combined come up to almost what we're doing in that space. Yeah. So we've been very, very fortunate there. And along the way, we were the first company to introduce disinfectant-ready plastics, and we really kind of invented the technology around the Xenon scanner when we introduced that all those years ago. We were the first company to introduce a laser-free scanner for aiming, because obviously you don't want to have lasers around the patients to potentially shine them in a patient's eye. We are the first to develop a locationing solution around scanners to find them when they get lost. We were the first to develop a programmable Bluetooth scanner. So that has been quite a large and significant contribution to the healthcare space. And first to deliver a battery-free scanner in the space. So lots of firsts with us, and we've been around the space for a long time. Obviously we've got print plays there, and of course we're here today to talk about this thing, which is our latest mobile device, the CT30. So hope that answers your question.
Yeah, I mean, I had no idea all those firsts. That's truly awesome, and it seems to me that the ability to be first is really, a testament to your ability to work very closely with partners in the healthcare space, right? To get that direct feedback from the people using the devices, right?
Jody, it's so true. I mean, we take feedback from important, partners like yourselves, as well as, of course, from the end user community. And, our devices are really designed in conjunction with you. I mean, you're kind of boots on the ground, and the relationships that you have with those end users, and the feedback that comes from you and from those end users really helps us understand what the market is asking for. And then, of course, with our engineering background at Honeywell, giant company, Fortune 75 company, et cetera, we're able to apply those engineering resources and deliver solutions that are really meeting the needs of our customers. So yeah, we couldn't do it without you guys.
That's awesome. Well, I know that GW, you probably heard similar buzz around the Honeywell space in particular now this latest, we're listening to the market, we're coming up with a new product. Talk to us about maybe some of the perspectives that you're hearing from the Honeywell team on, what you were hearing and why the CT30, was so important to add to your portfolio.
One of the things you're going to look at right away as we get into this, and we show you the size. When devices are there, when the community, the healthcare community is using them, the ability to pocket. When you get into the heavier devices, they don't fit well in a pocket. So that was one of the first things that we hear. You can see Mark's holding it up now. It goes in, it'll go in the scrubs. It's not going to pull them down with the weight that you've seen in the past. We've developed for this a very nice belt clip for you, a clip that puts on it, because without that, that's what the professionals who use these are doing with them. They're putting them in pockets. So as we've listened to that feedback, our technology, when it comes to the ability to scan the security protocols, that's there, that's throughout our line. But how do we bring this into this space? So the CT30 is changing the game when you look at how we're using it now.
Yeah, and Sue, you've been in this space for a long time, maybe not healthcare, but you've always thought about those considerations of what's really important in terms of a mobile computing device and what does that user need. You're probably hearing similar things, when you're out there in the field saying like, we need these attributes, but we also need to be able to scan a lot. We also need to be able to do enterprise level stuff, right? Still important to think about using a device from Honeywell versus something from a consumer company, right?
Totally right, Jody. There's so many challenges and limited resources as it is within healthcare, and having the flexibility of having something, not an iPhone, but with Honeywell and their CT30 and the ruggedness on it, it's absolutely gonna be a killer. It's there. We actually have someone that's using it right now, and it's a big difference. They like it. It's lightweight. They don't have to worry about it. They have to drop it. They know it's going to work. And, there's a lot of challenges within healthcare too. So that's why with them having actually something they can use every day, and they know that it can be maintained well and it's working. Battery life's another thing too that they really like on it. So yeah, it's definitely a game changer.
I love that idea of looking for quality and durability. I think that is just a great approach, strategic approach across the board. But specifically when you're investing in technology. Rob, I'm assuming you're hearing similar things now that you're getting out there and starting to deploy.
Yes, definitely. And thinking about it from the standpoint of patients belonging tracking, I think the form factor combined with the communications and the healthcare features that Mark mentioned, the green laser, the being able to sanitize and work in harsh environments is really critical for us. When we talk about PBT, we're talking a lot about nurses and security officers, so people that are always on the move.
Yeah.
So that the ability to connect with the voice and text tools as they go through their property tracking activities, as well as just their critical day-to-day work that they do is really important.
I love it. And Rob was already dropping some acronyms in on us, which we're going to get to in a little bit. But yeah, PPT, put that in your brain. We're going to hear a little bit more about that.
Jody,
yeah, go ahead, Mark.
Yes, yeah, I was just going to throw another concept out because I think it matters. When you ask, why is Honeywell developing these devices, and what's kind of the differentiator. And Sue, you mentioned iPhones, and I think Rob, you did too. And certainly iOS and iPhones have a bit of a foothold in healthcare. But we really came at this from a different perspective, and I think it's worth mentioning. Because again, Honeywell, giant company, we are in the business not of building consumer grade devices. We are building enterprise class devices. Mm-hmm. So one of the key differentiators for us over, for example, an Apple, and frankly, even our primary competitors in this space, was we took a look at the market and said, okay, when Microsoft got out of the operating system business, when they abandoned the Windows mobile platform, and we kind of all had to make a choice of where we were going to end up from an OS perspective, and clearly it was either develop your own proprietary OS, which is not a very good idea, or go with something, go with the other alternative, which of course was Android.
Yeah.
So we, along with the bulk of the industry, went down the Android path. But while we were doing that, in that process, we really started to take a deeper look at, all right, so how can Honeywell bring more value to our customers? How can Honeywell drive down a total cost of ownership for our customers and deliver a product that's going to last a longer time, have a longer life cycle? Because at the end of the day, whether it's Apple OS or whether it's Android OS, those operating systems are fundamentally consumer grade operating systems. And as a consumer grade OS, they're designed to go on consumer grade devices that are designed to be replaced every 3 years. Well, it doesn't work that way in the enterprise, right? I mean, the enterprise is looking to buy devices and have a longer runway for use of these devices. So again, Honeywell, our engineering team did the right thing, and I think, and we essentially went to Qualcomm and we went to Google and we cut a deal. And we kind of flexed our muscle a little bit, and in the size of Honeywell, we were able to do this. And the deal that we were able to cut essentially guarantees the end user that they're not going to be replacing this in 3 years, but rather we're going to have a run on our operating systems for another 5 to 6 years, plus another 5 years of support after that. They're not going to replace this in 3 years. Right now, this device is scheduled to be fully supported through 2033. That's 11 years of use out of this device versus my iPhone, which, well, I'm coming up on 3 years now, so I'm going to be replacing here very soon. But I mean, that's significant. So if you think that, in the life of this device, of the CT30, I will have bought 4 of these to get me through the same that same time. So I think that I just thought that was probably worth mentioning.
And Mark, I'm going to double down on that a little bit. And it's very important in the Android space to make sure you're staying up on the current install base. That's where you're getting your current security in these hospitals with sensitive information. We want to make sure with this device, we're pushing out through Android 14 and 15. So as you say, that's where all the security patches are. That's where the software is, and gives you the most secure device with the life cycle that Mark talked about. So you're extending that and able to use these enterprise grade devices in this space. So
yeah, exactly, GW. Thank you.
So yeah, okay. I am going to toss a question quickly because I'm at home today and anything goes in the huddle. So real quick, because I'm a sustainability nut, so I love the fact that you guys brought up the longevity and the durability. I think that's such a key component, and it's so strategic. But let's start talking. We started to talk a little bit about the people using the technology, right? And so I think from a strategic corporate level, it makes sense to invest in something that's going to last through those life cycles, right? Now we're talking about the people who are using it. I want to talk about the different use cases where the CT30 is going to really make a dramatic difference. So one of those that we uncovered is the tracking of patient belongings. So at intake, when you check in and you need to pack up your personal belongings before you get into the hospital, this workflow barcoding found was very outdated in our world, right? So we're data capture nuts, and so when we see things that are being tracked on paper or in spreadsheets, we go, oh no, I think there's a better way. And this was one of those times, and I think thinking about the nurses in particular and our security professionals, those people were really seeking a way to do things better. And I think, Rob, I'm going to toss this to you to kind of give us a sense of what the landscape looks like when we uncovered kind of this little niche workflow.
We saw users looking at 3 different types of solutions for them. One is the one that you mentioned is just pen and paper, right? And you're doing that, and you have, if you're a nurse, doing intake, maybe you're in an emergency department, you're not going to be focused a lot on recording details around patient property. So you might record a cell phone, but you might not know exactly what it is or the condition or so forth. So pen and paper was one area that we saw. Also, we saw that organizations were doing basic tracking with their electronic health record systems like Epic, but a lot of those systems also just provide some very basic functionality and not really give them details. On the other extreme, we had organizations that were looking at evidence tracking solutions that law enforcement might use, which turned out to really be overkill, and a lot of people that we talked to were very dissatisfied with having to use that type of solution.
Right. And the thing is, maybe this wasn't that clear. I mean, it seems like a small thing until it's your stuff or your family member stuff. And then it's a really big deal. And actually coming through the pandemic, this became even bigger of a deal when you had a mass influx of patients, and it was very difficult to keep up with the tracking of belongings. And if sadly someone in someone's family passed away and you couldn't find that ring or that watch, I mean, devastation. And that's devastation, not just for the families, but for the nurse who has to deliver that news, or the patient experience person has to deliver that news. So we started hearing these stories, and obviously being on always keeping our eyes peeled on how we can help. We figured we could jump in with our expertise around automated data capture because we have partnerships with Honeywell, and because we know how to track things. It's part of our name, really. So Sue, talk to us a little bit about what barcoding, what did we create?
So here's how it really all started when we were thinking about it back in the day. We thought, what do we need to create? We know that we have a low patient satisfaction, right? Like you said, it compromises the patient's experience when they don't receive their, they could have watches, rings, earrings, whatever their property is that they're missing when they're checking out. So A, that compromises their experience at that hospital. B, you have the nurses, this is in my eyes, right? B, you have the nurses, it's a waste, it's insufficient use of their time looking around for this patient's belongings, right? So then my other key thing is too, when they're looking for it, what storage area did they put it into? So, I have all this paperwork, I don't know where everything is, and then now it's lost. So now I'm compromising the hospitals when it comes to lost property claims. So now we have lost property claims, we have patient poor experience, we have also the, we can't find anything, what storage area is it in? So that's where we came up with the patient belonging tracking, where we started thinking, okay, what's the challenges? And let's start making sure that we have good resources for it. So that's where patient belonging tracking was developed, PBT.
Yes.
Okay.
That's our IntelliTrack application.
That's our IntelliTrack application, and what we call it, PBT, patient belonging tracking. And basically, I'll let Rob go ahead on this part and get more into the details of how we started it and how it ends.
Okay. All right. So basically, I think Sue really hit a lot of those points, right? Patients belonging tracking is our solution for healthcare professionals to maintain the chain of custody tracking of patient property and belongings when they're stored and taken in possession by a medical organization. There's three sort of key workflows associated with that. One is the collection and storage of the property. There's a lot of tools built into PBT checklists, being able to capture photos, things like that really make the collection accurate and easy and efficient for users. The retrieval and return is the other piece of that. You can see where all property is. One scan of a patient wristband, you can see where all of their property is in the hospital. Maybe some property is stored in a safe, some valuables, others in a general area. So you have the ability to see everything and not miss something. So you have to go back and return to the storage room to find that, again, becomes more efficient for the user. And then the ability to move property between between storage areas, which really opens up a lot of different types of use cases. So a patient that might have gone into the emergency department, for example, their property is collected there. And then they ended up getting admitted into the hospital, so the property moves along with them. Or perhaps you have a patient that's going into a long-term care facility from a hospital, so another facility within that organization. You can track the property between those facilities as well.
It's so interesting because this was such a strategic partnership with Honeywell. We, as barcoding, and a lot of folks maybe didn't realize this, we had a legacy tracking application called IntelliTrack that actually did quite a bit of tracking of items in healthcare. So we were really primed and ready to kind of take on this particular workflow when we saw it and we knew there was a need. So we combined that new functionality on our modern IntelliTrack platform. And then you bundle that with the power of the Honeywell CT30, and you really do have a transformational solution for nurses and security professionals to all the things that Sue was talking about, right? I don't want to go to work and waste my time, writing stuff down and looking for stuff in storage rooms. Like, I want to help the patients. That's why I became a nurse, right? I want to be able to have confidence that I know where things are. That's the beauty of automated data capture, right? I mean, GW, I think this power of this device with the application on it, that mobile application, I mean, that's the sweet spot of a partnership like ours, right?
Absolutely. And, you heard Rob say, the ability to take pictures, the ability to make sure you're doing this without writing things down. So when you're taking those belongings and there's something there, not only are you recording it, you're taking a picture of the condition it's in. The Honeywell CT30 does that all in with one device. You're able to scan very quickly to register where it is, take the picture, upload the picture so it is with it. So now there's no discussion of, well, this wasn't the condition that I gave it to you in. After we give it back, of course, because we know where it is and has it followed that particular person. So by marrying these two together, it makes a very simple work process, a device that's easy to carry and very functional when you're doing this and solving a problem that has been identified in the space as well. So
Yeah,
you know
Mark,
what?
go ahead. Go ahead.
Oh, you know what, GW, you nailed it on the head. The key thing, and same with you too, Jody. The key thing here is the nurses, all they want to do is scan that wristband that patient has. It's a unique ID number. And then guess what? They're going to scan what they have as far as when you brought up about the property, what kind of condition is it in? They don't want to write. Nurses don't want to write. They want to take that picture. They want to check. Oh, let me take a picture of that wrist, your wristwatch. Let me take a picture of your ring. That 5-carat ring that really was a carat. Okay. And they've ran into that. Nurses love not writing. That's why it's so efficient. Having that CT30, they're scanning that wristband, they're checking what the individual patient has, they're taking pictures of how it looks, what it looks like, and the condition. They're having them sign off. They're done.
Yeah, I'm curious, Mark. I mean, you were kind of introduced to our solution this past year, in a year and a half maybe now, but what were your first thoughts kind of when we brought this up? I mean, had this been something that you had seen kind of in your work previously, or was this some kind of light bulb for you?
Yeah, it really was kind of a light bulb moment for me. I mean, I remember when I heard about PBT and it just kind of dawned on me, this is a workflow that has really kind of gone utterly unaddressed in the space. And I was I was really taken aback that your guys' brilliance on this.
Hey, that's on camera.
Yeah, right. You deliver the solution. I think it's a much needed and unaddressed segment of the market. So there's a real opportunity out there.
That's awesome.
Yeah, and Jody, just to touch on your point about the IntelliTrack platform. We're also finding that, because IntelliTrack does so many different things around asset tracking and consumable inventories, there's been interest from those users that have looked at PBT in some of these other areas as well. Being able to track bandages and other, first aid supplies, at a nurse's station, and being able to use that consumable inventory feature and so forth. So, so there's a lot of synergy that users can get from this as well.
Yeah, I'm a newbie to the healthcare space, but I assume that people are people, and who likes writing stuff down? No one. So I think that, those, for those of you watching, if you have processes where you are writing stuff down and it tends to be error prone, or it tends to be very tedious. I mean, these things are ripe to be looked at for a barcode based data capture or some other technology based data capture. Of course, there's RFID tags and sensors and all that sort of thing too. But the barcode itself has stood the test of time. It's still just a bedrock for efficiency, accuracy, and so I encourage you all to look at those other areas outside of patient belonging tracking, because as Rob said, there's probably more places like this. But
Jody, if I may, you're really hitting the nail on the head there. I mean, these devices are not, single-use devices, right? I mean, think about how you use your cell phone, right? Think about how you use your laptop, things about how your tablet, whatever it might be. These devices are designed to do lots and lots of different things. And I can't show it very well because I've got this darn background thing on. But
well, people will just have to contact us, and then we'll let them see it.
Right. But yeah, again, so if you think about it more as a tool, like a Swiss Army knife, right? I mean, PBT is certainly an application, and a workflow that we support and is a needed workflow, and that's fantastic. But if you've got an enterprise class device like this, and you've got a tool that is as powerful as the CT30 with, state-of-the-art chipsets. I mean, we're really leading the industry in these designs. Plenty of memory to support the applications that you want to run today and tomorrow. So it's like, we've got, I think, 6 gig of RAM on this device, right? We've got absolutely the best radio and antenna combination in the business. I can speak to you honestly right now. We've got trials going on at a number of large health systems that are my customers out west, and it's just rocking in voice communications. They're not dropping calls. They're able to, our advanced algorithms for roaming and whatnot. The devices are bouncing from access point and access point particularly well, particularly as it compares to our competitors. But if you look at it, so again, it's not just PBT. It's med administration, right? It's tracking specimen collection. So if we're doing blood draws and whatnot for labs, we're fully integrated with the big EMRs. So we support Cerner, we support Meditech, we support Epic. Those platforms are able to run on this device. The labs companies, gosh, I just drew a blank, but the SunQuests, for example, of the world. Inventory tracking is another application that these devices are being used for supply chain and whatnot. So these hospitals and health systems and know what they've got, where they've got, or where they would go to do a replenish on a floor or a nursing station. The alarms management. So when a patient clicks a button on their bed to call a nurse for something, or if labs are trying to contact a nurse to let them know that the blood results are back, or that maybe it's coming out of radiology that the MRIs have been read and they want to let the nurse and the doctors know, right? Then it's clinical communications, so voice communications and replacing the phones, the old candy bar phones that the nurses carry, and giving them a device that can be used for voice communications, not only as in a typical telephony type of situation, but even push to talk, so kind of walkie-talkie communications throughout a care team. So there's so many different things that you can do with this device, and it's just exciting the heck out of us as we watch this with this, our little baby get launched here, and the reception has just been overwhelmingly positive from the end user community. So I'll get off my soapbox and let you guys carry on. But
this is your soapbox, Mark. This is why we're here.
Right,
this is exactly why we're here. No, I love it, and that's the passion. Like that's the excitement. I mean, that's that's why the barcoding team loves working with the Honeywell team. I mean, the excitement and the passion that you bring for your job and the technology you're bringing to bear, it's great. And you know, you want to be part of it. And hopefully everybody feels that through the video. But yes, I think technology affords you many things. And the great thing is that once it's in use, all these other possibilities become apparent that weren't even apparent when the investment was made. So my example is always duct tape, right? Duct tape, what it was produced for, the problems it was supposed to solve, no one could have imagined the possibilities, right? Well, these types of mobile computers they operate in a similar way. You may invest in them in order to improve the tracking of your patient's belongings and property. And you might make that investment there, but then once everyone starts using them, you're going to start to look around and say, okay, all of those great other applications that you mentioned, Mark, why don't we do it? Why don't we leverage it? So when we talk about investment, though, I am curious too, because you've been out there kind of having these conversations with PBT in particular. So tracking of patient belongings, because people haven't been doing it and they've been doing it kind of in a manual way. You know, what types of conversations do you have to justify that investment within the hospital, their healthcare facility? Like, what do you kind of bring up to let the people know that they really need to take a look at this?
You know,
Is that meant for me?
Well, I guess I'll throw it out to everyone, but I was hoping maybe Rob or Sue would kick it off.
Okay. We are from what we've been able to gather in terms of research, even small to medium hospitals spend thousands of dollars a month on lost property claims. So, and sometimes the number is significantly larger. So just from the absolute bottom line, that's a key ROI factor for them. I mean, the other things that come into play are efficiency, right? You know, nurses have demanding jobs. They they have to address complex patient needs, make quick decisions, and all along that, they probably spend 20 to 40% of their time doing administrative overhead type functions, and property tracking plays into that. So being able to not have to do rework, to go back to a use example before, go back to a storage room because they left a bag of property there, or kind of deal with even finding the property in the first place, is an important part of the ROI as well. And then maybe a little more intangibly, is the patient satisfaction. Right. And that if a patient knows and can trust that you're keeping track of the little things, like their property as well as their health care, then that builds trust with them, and that's really important too.
You know what, you touched it right, Rob, too. You know what the key thing too is? It improves the patient's experience. They're already in there already. They don't want the patient to be more stressed. They want, to have it IntelliTrack simple. They want it to, be effective for their security of the patient's belongings. They want, the nurses, they don't want to spend their time consistently looking for something. They want, and nowadays, especially too, within the hospitals, they want it to be effective. They want less stress for their patients.
Less stress, right? I think what all of us could use a dose of that
Right?
at any given time. Oh, well, I'm so thankful for the partnership with Honeywell, and I love the new CT30. We're so excited to be part of this launch with you all. Great feedback from the field, and obviously so many possibilities here to solve real problems for real people. And I think that's the key, right? I mean, sometimes we get nerded out in some of the specs, but really what we're talking about is, all these things matter because people matter, and people's jobs matter, and people's health matters. So GW, I want to kind of pass the ball to you one more time. Maybe just give us that final summation of all the amazing kind of components of the CT30 that you really want to make sure people remember.
We talked a lot today about what the problems we're solving. one thing I want to point out there is this process gives a digital footprint and it makes it easy. You know, we all want to do things easier, whether it's from taking the pictures to where you're storing it to where you're retrieving it. I've taken that away, that this is easy. When you look at the CT30, we've got a device that's lightweight, very powerful for all the reasons we spoke of before. It's going to improve your job, improve the process, and ultimately improve the patient's experience in your healthcare system. So, and doing all this with a device that's pocketable. So that's a big deal. Mark, I'm going to kick it to you. What did I miss here? I'm going to tag a friend on this one.
Yeah.
Sorry, I was on mute. GW, I don't think you missed anything. I mean, we're pretty, as you mentioned, we're pretty excited about the 30. I mean, it's the form factor is really spot on. I mean, as you know, as we keep trying to show it, but it's really the size. This is an iPhone, I don't know, 12, 13, whatever the heck it is. Every year they come out and you got to buy a new one. Not with this, but it's the size of the iPhone, although it weighs less. And it's got batteries that can be replaced, so you don't need to buy twice as many phones as you need. What do I mean by that? That means that, okay, so say for example, if I need 500 devices to be in use in a facility to support a max census type of scenario, and if I'm using iPhones, if I need 500 at max census, well, it actually means I need 1,000 because, well, batteries can't be changed. So that means I have 1,000 being charged while 500 are being charged while 500 are in use. Over here, you just swap batteries. Next shift, put in a new battery, off you go. You're good for that entire shift. So you got a device that's lighter than an iPhone with integrated barcode scanning, near field communications, Wi-Fi 6, Bluetooth, the latest generation of Bluetooth, tons of memory. It's just positioned beautifully, and we're really excited about it in the healthcare spaces and other spaces as well. And certainly excited, Jody, to be working with you guys and your team for patient belonging trackings and other applications. So I think we're right where we want to be.
Well, I couldn't agree more. So I feel like this has been such a great conversation today. I really appreciate everyone's perspectives. We had quite a wide variety of perspectives, which I think is always helpful for a conversation like this. So thank you, each and every one of you, for participating today. Thank you to Honeywell for sponsoring this huddle. We truly appreciate our partnership. And for those in the Baltimore area, you know that Honeywell is also sponsoring a chili cook-off this year. So, I mean, that's the kind of partner that we're talking about here. We're the kind of partner you can eat chili with. So thank you very much for that. And so I wanted to wrap. If this video got you very excited and you're really interested in learning more about either ways that we can improve the tracking of your patient's belongings, property, or you just want to get into the CT30 or a combination of both, and you can go to barcoding.com, just hit schedule a consultation and we will take good care of you. You can obviously call us, reach out to us on LinkedIn, that sort of thing. But barcoding.com, that's the easiest place to start, very, very simple. And of course, subscribe here because we've got lots more video content coming your way. But once again, thank you all very much, and we appreciate you and can't wait to see you next time.
Thanks, everybody.
Thanks, everyone.
Thank you.
Thank you.